Tonight's second lecture will build on the insights that we have gained from the previous talk. The lecture will focus on discussing the oral health problems that are unique to adolescents and a review of the anticipatory guidance based on the AAP Brightfutures recommendations. The session will be rounded off with tips on how to make one's approach and practice adolescent-friendly. Our next lecturer completed her medical degree at the Pamantasan ng Lungsod ng Maynila. She underwent fellowship training in adolescent medicine at the Philippine General Hospital. She is a diplomat of the Philippine Pediatric Society and she is currently a consultant at the Department of Pediatrics at Binakayan Hospital and Medical Center in Kawit, Cavite. She is a visiting consultant at the Department of Pediatrics at Perpetual Health Medical Center, Las Piñas. Join me in welcoming our second lecturer, Dr. Miriam Joyce Domingo Valenzuela.
Much for that kind introduction, and good evening, everyone. I just want to take this time to thank Philippine Pediatric Dental Society for the invitation. So I will just share my screen. Can you see my slides?
Yes, Dr. Miriam.
And okay, so I hope you can hear me clearly as well. Okay, so we have learned from the lecture of Dr. Lianto that adolescence is a critical period that presents with great opportunities and significant risk and dangers. A lot of people, including parents, teachers, healthcare workers, even pediatricians, find it difficult to talk to a teenager. For our dentists in this room, I'm sure that you are not exempted and you also encountered unique challenges when dealing with teenagers. That's why this evening, we're not just going to talk about adolescent oral health, but we will also present practical ways on how we can make your practice adolescent friendly and hopefully address some of these challenges. So here are the objectives of this lecture. And this will be the outline. First, we will discuss the main health issues affecting adolescent oral health, enumerate common oral health problems among adolescents, and then we will define adolescent-friendly health services and describe its characteristics and share information that should be discussed when providing anticipatory guidance. Let us begin. Question: what is the name of the current population of adolescents? Is it A, Generation X, B, Generation Y, C, Generation Z, or letter D, Generation Alpha? So please type the letter of your answer in the chat box.
A few responses are coming in the chat box, Dr. Miriam.
Okay. Okay, I'll give you 5 more seconds to answer. Okay, time is up. The correct answer is letter C, Generation Z. Now, may I know which generation do you belong to? Are you a baby boomer, a Gen X, a Generation Y, or millennial, or Generation Z? Again, please type your answer in the chat box. Wow, it seems like we're from different generations. I can see some baby boomers joining us in a Zoom meeting. We have Gen X people. I'm actually from Generation Y. But for tonight, let us talk about Generation Z. Let's get to know more about them. So Generation Z are teenagers born from 1995 to 2009. The oldest is 25 years old, while the youngest is 11 years old. They're often called digital natives or screen agers. They are born to swipe, masters of social media. They prefer video messages over texting, and they demand 24 access to the internet. Before the COVID-19 pandemic, this survey showed that 42% of FB users are young people. And the average daily time of social media users from the Philippines is 4 hours. So that makes our country number one in terms of daily time spent using social media. The global average is only 2 hours per day. And during COVID-19 pandemic in April 2020, 64% of internet users from the Philippines reported spending more time using social media. So meaning it's more than 4 hours per day. Although it's not surprising because of ECQ and nothing else to do, we should still be concerned about this. Why? Because too much screen time means less time for physical activity. And less physical activity, as we all know, has negative effects on health and well being. A survey by FNRI in 2018 showed that a large proportion of Filipino adolescents are insufficiently physically active, which means that they spend less than 60 minutes in doing moderate to vigorous intensity physical activity per day. More young people eat unhealthy food. About 1 in 4 Filipino youth drink soda, eat cup noodles, and chips at least twice per week. This is important to note because unhealthy diet contributes to poor oral health. Because of this lifestyle of insufficient physical activity and unhealthy food habits, many Filipino adolescents are not growing healthily. They still suffer from the triple burden of malnutrition. 11.3% of Filipino adolescents are wasted, 26.3% are stunted, while 11.6% are overweight or obese. On the other hand, 11.4% of pregnant adolescents are nutritionally at risk. Poor nutrition compromises adolescents' growth and development. So substance use begins during adolescence. 1 in 5 of Filipino high school students who participated in this survey are current smokers. Are current drinkers, while 50% of those who ever drank alcohol started before age 14. Tobacco and nicotine use also affects oral health. Roughly 1 in 10 are current smokers, while 15% had used any tobacco products, including vaping. How about drug use? Although only 7% of high school students said that they use marijuana, 80% started using drugs during early adolescence, again before age 14. Physical violence among Filipino youth are prevalent, and there are actually more aggressors than victims. Among high school students, almost 50% had experienced bullying. So this psychosocial issue is important as it affects mental health and heightens body image issues, which may have implications on their oral health needs, specifically aesthetic concerns. Cyberbullying is also prevalent. So this data is pre-COVID-19. So it could be greater now during this pandemic. Nearly half have ever experienced cyber violence, and while 80% have been cyberbullied through social media. It comes as no surprise that there is an increasing burden of mental health problems among this age group. According to WHO, 50% of mental health conditions start by 14 years old. Behavioral concerns may contribute to poor health-seeking behaviors and adherence to dental health plan. Local survey had shown that 12% of high school students seriously considered attempting suicide, 11% have made plans, and a larger proportion, 17%, had actually attempted. More Filipino youth engage in premarital sex. So, in a survey conducted in 2013, the prevalence rate is at 32%, and this has steadily increased in the past 2 decades. 23% 23% engage in sex before 18 years old, and 7.3% engage in FUBU, and 3.5% had casual sex. You might say that anyway, the prevalence rate is relatively low. Why should we be concerned about it? Well, it is because that 78% of those who engage in sex had not used protection against unintended pregnancy and sexually transmitted infections, including STI, HIV, and AIDS. So in 2017, 1 in 10 women aged 15 to 19 years old have begun childbearing. Our country loses about 33 billion pesos every year due to teen pregnancies alone. Adolescents living with HIV and AIDS are also increasing, and this is related to their sexual risky behaviors. So recently released data from HARP showed that 5% of newly diagnosed cases were adolescents, and all were infected through sexual contact, commonly by MSM, or what we call men having sex with men. Latest integrated HIV behavioral study by DOH showed that among males and transgender women who have sex with males had engaged in oral sex earlier than anal sex. So why is this important to discuss all of these issues among adolescents? Well, it's because adolescent risky behaviors affect oral health. Sexually transmitted infections have oral manifestations such as oral thrush in immunocompromised patients like people living with HIV, lesions caused by herpes infection, syphilis infection, and even human papilloma virus infection. Not all oral lesions are caused by sexually transmitted infection. So let us not be judgmental. But it is important for us to recognize these lesions during dental health visit, as it may offer opportunity for you to prompt the adolescent to seek medical care and treatment. Adolescence also marks a period of significant caries activity for many individuals. This can be explained by physiologic, environmental, and social factors. Traumatic injuries to permanent teeth, secondary to fall, traffic accidents, physical violence, and contact sport are also common. Teens start to express themselves through body piercing, but intraoral and perioral piercing may have dental health consequences. Severe enamel erosion is another problem seen in eating disorders, specifically bulimia. Tobacco and nicotine use can cause stained teeth, bad breath, periodontal disease, oral cancer, and whitening of oral mucosa. It also affects healing after tooth extraction and gum surgery. Adolescents also have a higher prevalence of periodontal disease. This can be secondary to the rise of sex hormones during puberty and other behavioral factors such as poor brushing and flossing habits. occlusal problems with associated disfiguration, aesthetic concerns such as tooth whitening, removal of stained areas or defects, and behavioral considerations such as in the case of anxiety, phobia, and intellectual disability are also common concerns. Because of these health issues and special concerns in this age group, the American Academy of Pediatric Dentistry recommends supplemental medical history regarding questions focused on psychosocial issues enumerated on this slide. These issues can impact the health status of the oral cavity, influence care seeking, and compliance. This also presents a chance for the teenager to be linked to holistic care. The problem is, in general, teens do not want to share sensitive information. What are we going to do now? How can we make our practice adolescent friendly? So to answer those questions, we must understand what is adolescent-friendly health service. This term was used by the WHO in 2002 as an agenda for change. So during this time, the world has begun to recognize the value of caring for this most often thought healthy population. 10 years later, WHO produced a guidebook as part of a set of tools that that standardizes and scales up the coverage of quality health services to adolescents. In the Philippines, the Department of Health published the first manual of operations for adolescent health and development program. Oral health is included among the health indicators. So to be considered adolescent friendly, health service should be accessible, acceptable, appropriate, comprehensive, equitable, and effective. When you say accessible, adolescents are able to obtain the health services that are available. Acceptable means that adolescents are willing to obtain the health services, while appropriate, it means that the right health services are provided to them. They get the services they needed. Now that we know the qualities of an adolescent-friendly health service, how do we translate them into more practical terms? For your clinic setup, it is important to provide a relaxed, welcoming, developmentally appropriate clinic setup. So staff should be familiar with the developmental and health needs of the adolescents and should adopt an open and non-judgmental attitude. We should also take time to gain confidence in addressing issues related to assent, consent, privacy, and confidentiality. Educational materials such as posters, infographics, and brochures are also helpful. For the clinic appointment, offer a flexible schedule. It may be helpful to provide an after school or afternoon appointment so that the teenagers, although they are having online learning now, they still follow the regular schedule so that the patient does not need to miss their school. And also, consult the adolescent and parents to encourage shared decision making. Here are the steps in adolescent-friendly interview which we apply in our clinic. You may adopt this no, in your dental practice. So the first two steps are very important as it empowers the adolescent. Unlike in younger children, the first one that we greet is the parent. But for when dealing with adolescents, we should introduce ourselves to the adolescent first. And then we ask the adolescent to introduce a companion. Next is we explain the format of the interview. So the general format is you see the teen and parent together, then negotiate to see the adolescent alone, and then call in the parent or companion at the end of the interview or the procedure that you're going to do after you have discussed the plans with the teenager. The interview and the physical exam may be different for dental practice, but towards the end, it is important to discuss the plans with the adolescent. And after that, you will call in the parent and set up a follow-up date. Assuring adolescents, by the way, about confidentiality is important as it increases their willingness to seek care and to share sensitive information. So here are 10 principles in approaching adolescence. First, we should use active listening skills, acknowledge the concerns of the patient, and refrain from giving your judgment and advice without first getting permission. Take time also to explore behavioral context and be mindful of nonverbal cues and do not use medical jargons. Act as an advocate. Help them arrive at their own decision and promote the patient's personal responsibility for their oral health. Lastly, function as a concerned adult who is non-judgmental when listening, advising, and providing guidance. Do not act like a parent. In as much as we encourage also using adolescent-friendly approach, avoid a peer role. Be professional. A lack of formality and sense of humor may be inviting, but dressing and talking like a peer are not. Avoid stereotyping as well. When um, when conducting psychosocial interview and providing anticipatory guidance, always use a strength-based approach. Affirm good behaviors and address risky behaviors. If there are issues that you cannot address or it's beyond your scope, please do not hesitate to refer them to their pediatrician or adolescent medicine doctor when necessary. When encouraging behavior for change, behavior change from patients and families, use shared decision-making strategies and motivational interviewing techniques. So there are actually videos available online for this. Do not assume that the adolescents know the proper way of brushing and flossing. So please patiently demonstrate these skills to improve desired outcomes. Since we are dealing with Generation Z, let us take advantage of using other tools and even online resources. And lastly, because they are concrete thinkers, especially the younger adolescents, consider providing a written dental health plan. Always send your patient home with a smile. So wrap up plans and provide anticipatory guidance. Help them understand the importance of daily oral health hygiene, limiting soda and sweetened beverages, reducing in-between meal snacks, and using a mouth guard during contact sports. And begin conversations with about smoking and drug use. So as I end, I would like to remind everyone that adolescent oral health is beyond taking care of their teeth and gums. Psychosocial issues and other social determinants of health must be addressed. Your investment in adolescent oral health by applying adolescent-friendly health service standards in your own practice will surely go a long way. Your participation tonight, no, in this lecture is actually an investment to adolescent health. So with that, I would like to thank you all for listening.
To thank Dr. Miriam for a very practical and relevant lecture. I'm sure all of us here will be able to apply to our own practices whatever tips you have given to us tonight. We would also likewise present the Certificate of Appreciation to our second lecturer, Dr. Miriam. Allow me to read the certificate again. The Philippine Pediatric Dental Society, together with the University of the Philippines Manila College of Dentistry, presents this Certificate of Appreciation to Dr. Miriam Joyce Valenzuela in grateful recognition of her participation as guest lecturer and for sharing her expertise and knowledge through the topic Adolescent Oral Health, Tips on Making Your Practice Adolescent Friendly. given this 28th day of August 2020 during the PPDSI String of Pearls webinar series. Signed, Dr. Paul Abaya, PPDSI President, Dr. Danilo Magtanong, Dean of the UP College of Dentistry, Dr. Rowena Castro, Awards Committee Chair, Dr. Jean Arevalo, Coordinator for Continuing Education, and Dr. Hazel Talasunico, Scientific Committee Chair.